Hello, yeah. Good afternoon, followers and listeners. As usual, I am Counselor Palmas Adu, and marriage and relationship counselor and coping skills expert. So today we want to look at something about coping skills. Send a bear a bit man so a boy a bra na BBI then I come yabra bo no. There was who say in this life there are a lot of behaviors that are normal. There are a lot of behaviors that are normal and a lot of behaviors that are abnormal. But one thing you need to understand is that what is normal in a certain culture might be abnormal in a certain culture. So when we say something is normal, which means something that is typical or accepted in a particular culture, and when something is abnormal, which means that thing is atypical or not accepted in a particular culture. So the same way when it comes to behaviors. In fact, because of pressure, stress, and other things, people tend to exhibit a lot of abnormal behaviors. But how will you know that this behavior is abnormal or normal? So that comes in when if you can distinguish between a behavior that is normal or abnormal, it will help you. It will help you. So today we are going to look at for you to know that this behavior is normal or abnormal. Before you can say that a behavior is abnormal or psychopathology or mental disorder, then that behavior need to have what we call 4Ds. 4Ds. The 4D, the first D stand for deviant or deviance. There must be deviance or deviant in behavior. When we say deviant, that means that behavior is different. Different. The behavior is extreme. Very different. So let's say you take we take, let's say, 10 men, we group them together, 10 men. Then you will see that 8 are into women and 8 no per man. But 2 says that we want animal. So you can see that there's difference in behavior. And this behavior is extreme, which means that they are exhibiting abnormal behavior. So whenever you see that behavior somebody is showing or someone is showing, it is different from a behavior culturally that settings they conform to, or it is extreme, then you know that you have to check the person's mental health. Then you know that the person there's a little bit problem. Another D, another D is when you say a behavior distress. The D is distress. When a behavior causes distress, the behavior is upsetting to the person or the behavior is causing clinically significant distress or impairment on the person's social, academic, and other functioning. Then you can say that this behavior is abnormal. Abnormal. The third D is when the thing is dysfunction or dysfunction or dysfunction, however you want to put it, either dysfunction or dysfunction. When we say a behavior is dysfunctional or dysfunction, which means that the behavior is interfering in the person's day-to-day activities. So let's say someone is having panic attack, someone is having anxiety, and you know how the panic attack is interfering with the person's day-to-day life. Affecting and all those things. So you can see that the behavior is dysfunctional. Then the behavior can be classified as an abnormal behavior. And the fourth and the last D is that when the behavior causes danger. So the fourth D is danger. When we say danger is that when the behavior poses risk of harm to the person involved or to others. So let's say somebody is having some, I want to get a perfect example. Somebody is having some paranoid feelings and thought. So the person sees others as a unloving, uncaring, not faithful. So the person want to harm. Or the person is suffering from, let's say, depression or major depression or bipolar 1, bipolar 2. Now, it can result that the person want to commit suicide, or the person have suicidal thoughts, or the person want to harm somebody, or the person is having what we call antisocial personality disorder, and the person does not conform to the societal norms. The person break rules, the person without showing any remorse, the person can steal, the person can hurt somebody. All these things pose risk of harm to the person or to others. Then you can say that the behavior is abnormal. The behavior is abnormal. So today, that is what we are going to learn. I believe that now you know the difference between when we say behavior is normal and abnormal. So it will help you so that when you see that your child is exhibiting some behaviors, whether it is normal or abnormal, your partner, your spouse, your friend, your neighbor, and other things, it can help you so that you can talk to qualified personnel or a professional, either psychologist, psychiatrist, medical doctor, a counselor, a therapist. Then it will help you. Know that for you to identify that a behavior is abnormal without using DSM and other and co, you have to get notice of the 4Ds: deviance, distress, dysfunction, then danger. When you see that a behavior involves all these 4D I've mentioned to you, know that that behavior is abnormal behavior. And until you say behavior and also be then a DBano, who say a causal distress, danger, dysfunction. Consus ania manoa and the difference will more. And so who say that behavior is abnormal. Send a baby a bit me a boy, I'm a baby I come. I am Counselor Palmas Adu, marriage and relationship counselor, coping skills expert. We are going to have some kind of coping skills as often as possible for us to help us as we are embarking on mental health. The Farmers Foundation is embarking on a mental health awareness campaign. We are going to do this often. We are going to take a lot of mental disorders one by one, one after the other. We talk about, discuss how you can go about it. It will help. So be with me on this journey as I take you through coping skills, how you are going to cope with some of these mental disorders, how you are going to manage your stress, anxiety, and co. And you are going to be, it is going to be of help to you and the nation. You know that from 2020, as we have that COVID-19 came, the pandemic has brought a lot of stress, pressure on people. And a lot of people are exhibiting a lot of behaviors that are abnormal, that we need to help them in order not for them to harm themselves or harm others. Bye-bye. We shall meet again.